is the most responsive, type 2 diabetes, very responsive to very simple treatments, mainly diet and exercise and a few simple rules. And if people will do that, they can recover from diabetes. And so we have diabetes recovery or diabetes reversal programs. And you can indeed reverse diabetes in many instances. Childhood diabetes is a totally different disease from adult diabetes. With adult diabetes, you have plenty of insulin floating around. With childhood diabetes or type 1 diabetes, you have very little or no insulin. And so you must replace the insulin in children. Whereas in adults, in type 2 diabetes, they will respond to fasting, something that you can never do with childhood diabetes or type 1. You must never fast type 1 diabetics. You must never fast people with gout, although gout is often very responsive to very simple treatment, diet and exercise. And you can get gout under very good control. Even that's very symptomatic and very painful. Now with pediatric natural remedies, I suppose that my very favorite disease among children is infantile eczema when the child is 2 years old, because that's about the time that it's going to clear up naturally without any treatment. And if you happen to be the one who treats the patient at about 2 years of age, you'll be the one who has the miracle cure. And the mom is very grateful to you because she's already been to 5 other doctors and they have not been able to cure the disease. And I may have been one of those if the child was a year old. May have been one of those who failed because it's a self-limited disease in most cases. In some cases it does go on longer. If it goes on much beyond the age of 2, then you begin to think that maybe the diagnosis should be something a little different. Now I'd like to start with a disease in childhood this afternoon that we all encounter who treat children at all, and that's childhood fevers. One thing that you can do for a childhood fever is a massage. I had a little patient who had a fever one time. She'd been home all day. Fever was getting worse all day, and the father called me about 5 or 6 in the afternoon. By the time I could get there, it was around 7. The little girl was lying on the couch, not feeling good at all. She hadn't been playing all day and was feeling a little worse toward night, as children often do with childhood fevers, because the fever tends to go up more in the evening. And so she was beginning that period in which she was feeling bad. And I sat down on the couch with her and began to massage. I massaged her arms and her back and her thighs and her legs. And while I was working with her, her fever dropped 1.5 degrees. Probably I was with the family about 1 hour and 15 minutes. Much of that time I was just chatting with the parents a little and massaging the baby, the little girl. She might have been around 5. So after I'd been massaging her for that long, her little sister came out and started playing there in the living room. And the little sick girl saw her sister playing and jumped up and started playing with her. And so we knew that she was a lot better. So it's a very good remedy for children. And you can see here a mother massaging her child, and that's a good way to do it with a child or the grandmother, just rubbing the child's back. And in the case of the little girl I was telling you about, she wasn't even undressed. I just massaged her sometimes on her skin, but much of the time it was through her clothing. Then you can also do a hot mitten friction. That's especially good if the child's fever is 103 or above. And with a hot mitten friction, you bring blood more to the skin. With a cold mitten friction, you may be able to bring the temperature down by actually bringing the body temperature down with the cold compresses or the ice packs, as we used to do in emergency rooms. We put ice under the arms and in the groin in particular, behind the knees, behind the back, just putting ice on them and moving it around a little bit until the baby cooled down. We don't do that so much anymore. I don't think it's done at all in emergency rooms anymore, but that was standard treatment when I was an intern, that we would give them the ice massage. Now we know that putting the ice on contracts the blood vessels in the skin and makes the blood go internally, which is the way that the body brings up a fever anyway. And so you don't do a lot to treat the basic disease by going that route. So it's a lot better to do a hot mitten friction than it is a cold mitten friction in children who have fevers. Warm baths, what we might call a hot bath, maybe at 103 degrees or 104 degrees for a child with a fever. It's 1 minute for each minute of the baby's age. So if the baby is 3 years of age, it's 3 minutes. 4 years of age, 4 minutes, and so forth. Now from birth to 3, it's 3 minutes, but for the smaller child with a fever, the younger child, the temperature of the bath is lower. So it would be 101 or even 100. You can use higher temperatures if you would like, but the hot bath or the very warm bath will cause the child to be sedated. And if they've been crying a lot and they're uncomfortable and have been awake for a while just being uncomfortable, give them a hot bath and they will almost invariably sleep. So it's a very good sedative, very good healing agency for the fevers of childhood. Then sassafras tea, and you can see the sassafras plant here. You can recognize it. It grows in this area and probably everywhere that any of you live in the United States, the sassafras plant grows. You can recognize it because it has leaves that are called pleomorphic. That is, on the same bush, you will see one that's just like this. You will also see one that's sort of glove-like, like this, and then a mitten. And I don't think I've ever failed, unless the tree was losing its leaves in the fall, to find a mitten on a sassafras plant. And that's always confirmatory. There are a few other shrubs, wild shrubs, that look a little bit like sassafras. And of course you pull the little plant up and break off the root and make the tea from the root. It fills the house with a delightful aroma, and maybe the child gets a little aromatherapy. I know the mother does, and the rest of the family, they love the fragrance of the sassafras tea. And freshly brewed and cooled a little bit for a child with a fever. If you put a little honey in it, they will enjoy it very